My name is Brittany McClagan. I'm from Brookings, and I work at Knudsen Family Dental here in Brookings, and also I'm a fitness instructor at BeWell. They originally found this cyst when I was 19, and it wasn't small, but I had been having symptoms with it. And at that time, they did go over, this is not life-threatening. You can live with this cyst. It's just a matter of, do you want to, or do you want to just watch it and wait and see if it, goes down or if it grows. At that point, I'm young. I wasn't having daily pain with it, so I just kind of let it be for then. And then as life went on, it grew a little bit. Again, not a big deal, but it did come with pain and just irregular cycles. And that's when I went in with Dr. Tara and talked about options on what we can do with this, and if I want to, live with this and just see where it goes, or if I want to be done having daily pain. It was like my lower right abdomen, and it was just like on the inside, just a really sharp pain, and then it would dull down, and then I could kind of function, but basically just the pain every single day, just a constant. And it was, it would be really bad, and then it would just kind of, go away. I remember just recently, the worst day, we were getting ready to go to Sioux Falls, and I couldn't even put my pants on. It hurt so bad. And it's just like, it shouldn't be like that. I made myself think, it's not that big of a deal. And it wasn't an emergency, but once after it was done, it kind of put my mind at ease. Like, it's crazy right now, sitting right now here, I don't have any pain, and it's just weird. I don't know, like after I was like through recovery and everything, I was kind of looking for that pain, like waiting for it. And even when I'm at work, I'm just like, this is weird. I feel like I should be having pain because that's usually what I'm doing, what I'm in. I'm in pain, on that right side. And it's crazy how used to that a person gets, I guess. Oh gosh, absolutely. She definitely put my mind at ease. She was very thorough when she talked about the surgery, and she didn't really lean me towards the surgery. She obviously gave me my options. But at this point, seeing her after the ultrasound, I was like, nope, I'm done. Like, this thing is bigger than my ovary. Let's just get it out, She definitely made me feel like I was making the right decision, and the way she just explained things, I was very confident with her doing it and just getting it done. I just was ready to do it. I was not hesitant at all. I wasn't really scared. I was just like, let's get it done. I want to get it done and over with. It was actually really calm. I was a little nervous because I had never been intubated before. This is kind of like my first big surgery. So I was a little nervous about that, going to sleep. But otherwise, the procedure, I was just kind of like, okay, thank God it's here, but I woke up and my husband, Mitch, had said that she was able to save my ovary, and I was just like, oh my gosh, that's just so great. I wasn't gonna be upset if she had taken it, but I was like, that's great. She really thought that she'd have to take my ovary. So she did take a part of my tube because it was more connected to my tube than it was my ovary. Everybody's attitude and just patience with me and knowledge, like knowing these people know what they're doing, it just made me feel a lot better about the whole day. So it was really nice. I didn't feel rushed to get out. They were very patient with me, and very, like I said, they just knew what they were doing. If I had a question, it wasn't, hurry up and answer it so we can get her out of here, or, it was just, whenever you're ready to go, we'll help you, just buzz us, call if you need anything, and if I had any questions, they were right there to help. I'm pain-free. It's insane, and there are some days where I think it's just weird not to have that pain, but it's normal. It's not weird. So that's, and then just kind of, I feel better. And then I don't have that thought in the back of my head, like what's growing inside of me. It's more of a peace of mind now that it's gone. I was taking a lot of over-the-counter medications to help, and I don't do that near as much because of the pain, so that is, and pain does take a toll on a person, I guess. It got to be a lot. There were some days that it wasn't very much, and then there were some days where I felt like I wasn't being understood how much pain I was in. It didn't even cross my mind to have it anywhere else. Dr. Tara practices here, and I never once questioned anything she had told me. There's just kind of like a confidence about her where I was just like, yeah, she would talk and I'm just like, yeah. Everybody treated me really well. I felt understood and I felt very taken care of. Everybody was so comforting and just there to help me and just wanted to help me. And that just made me feel like I was the only person in the hospital. I just felt like I said, I was the only one in the hospital. I was like their only surgery that day, and they just put all their time and effort into me, and it feels good.
Are you one of Brookings Health System's grateful patients who would like to give back to us? Learn more about how you can give back at brookingshealth.org/mythanks.